Good evening and welcome to this live telephone town hall. Right now we are dialing out to thousands of homes in your area across Arlington. On this telephone town hall tonight, we're going to be answering your questions live, and we're also going to give you a chance to be a part of interactive surveys. Our speakers will be joining us in just a moment, but first I want to tell you how you can participate in tonight's telephone town hall meeting. If you have a question at any point during the call, press 0. Press 0 if you have a question. You'll be placed in a queue, and then our operators will then assist you in asking your question live on the air. We're going to get through as many questions as we can in the time that we have allocated tonight, so please press 0 if you've got a question. We also encourage you to press 7 at any time on your email address to get the very latest from the city through email. So press 7 to submit your email address. We've got a lot of friends and neighbors who are joining us now. I'm going to repeat part of this message before I turn the call over to Mayor Jeff Williams, who's standing by. The call will be live in just under a minute. We want to welcome you to this live telephone town hall as we dial out to tens of thousands of homes across Arlington. On this telephone town hall tonight, we're going to be answering your questions live. Folks, we want to hear from you. Press 0 if you have a question. Press 0 if you have a question. From there, you'll be placed in a queue, and one of our operators will assist you in asking your question live on the air. We're going to get through as many questions as we possibly can tonight. If by chance you'd prefer not to go live on the air, no problem. Just let your operator know, and we can read the question for you, whatever's most comfortable for you. Finally, we encourage you to press 7 at any point during the call tonight to submit your email address to get the very latest from the city of Arlington. Press 7. A lot of important things going on right now, so please press 7 to share your email address so you can get the latest through email. Looks like we have a good crowd, so I'm pleased to turn the call over to your mayor, Jeff Williams. Mayor Williams, please take it away.
Well, good evening, everyone, and welcome to this Tele-Town hall meeting. And I am Mayor Jeff Williams, and in the past we conducted Tele-Town hall meetings in individual council member districts and opened the topics up to anything on the minds of our residents. Because we know so many of you are concerned about the coronavirus pandemic, we have gone citywide with our Tele-Town halls. And we're dedicating the next hour to answering your questions about the COVID-19 vaccine. And I have assembled the top experts in our city to answer your questions. And joining me are our fire chief, who oversees the Emergency Operations Center, Chief Don Krause. And also we have Dr. Cynthia Simmons, the city's medical director, who has an extensive background in emergency medicine. We have our city manager, Trey Yelverton. We have Michael Jacobson, the president and CEO of the Greater Arlington Chamber of Commerce. We are all here to answer your questions, and I really want to encourage our folks to help your neighbors and family members without computer access so that they can enroll in the vaccination program. In fact, we want to help tonight. And if you need help enrolling in the vaccine program, please press 1 to let us know and someone will call you. Now let's start getting to your questions, and the process is easy. And you can choose just to listen to the conversation, or you can also pose a question. So thank you for participating, and let's take our first question.
Thank you very much. And just quickly before we do, we've had some new friends and neighbors join us. If you've joined us and you've got a question, hit 0 on your keypad. Just hit 0. Our first question is Tarina, and she's got a question for Arlington Fire Department Chief Crossan. Go ahead, Tarina.
Yes, I want to know, when will the Johnson & Johnson vaccine be available?
Hi, Serena. This is Don Krause, the fire chief. And, well, good news. We have received a shipment of Johnson & Johnson. We've been using the Moderna vaccine at our East Sports Center, and we're using Pfizer at Globe Life Field. And the federal team has also shipped us about 6,000 doses of Johnson & Johnson, and we expect to be using that vaccine sometime next week. So the reality is that all the vaccines are highly effective, and we're fortunate to have all 3 here in Arlington. Thank you.
Next up, we have Dee Dee. She's got a question for Mayor Williams. Go ahead, Dee Dee.
Hello, Mayor Williams. I wanted to ask, I know Governor Abbott has opened up the cities in Texas. Okay, so as many deaths as we've had along the line of the pandemic, I was trying to understand how is it that we can just open up just like that and everyone hasn't had their shot? Because I'm 64 and I haven't had my shot, but I've been signed up since January.
Dee Dee, thank you for that question. And actually what the governor has done is that he is not mandating masks. And so he is giving our citizens a choice. And I issued a statement here earlier today that we still are encouraging you to wear your mask because, as you mentioned, so many of our citizens still have yet to be vaccinated, and neither have they had the COVID, so they haven't built up antibodies. So even though the governor has given us a choice, we are highly recommending that we follow the CDC guidelines, continue to wear your mask, keep your social distance, work on your hygiene, and please get signed up to get your vaccinations there. And we are hopeful that the vaccine supply chain will continue to increase. And in fact, I think that's a good thing that we're going to have a lot of questions about. Chief Krausen, could you tell us a little bit about the possible supply chain for vaccines and when you think that may be increasing?
Yes, Mayor. We believe that the supply chain is increasing as we speak, and we believe within the next couple of months. In fact, today President Biden said that there will be vaccines available for every adult in the country by May, sometime in May. We believe the supply chain will be dramatically improved just within a month. So good news is coming. Vaccine availability is going to be widespread throughout our community in the near term. So things are looking up as far as we can see. So all good news this point in time. Thank you.
All right, next up we have a question for Michael Jacobson, who's the President and CEO of the Arlington Chamber of Commerce. Michael, this is Shanicia. Go ahead with your question, please, Shanicia.
Yes. I had a question similar to what was already stated, just about whether or not we have to wear a mask and how does that work with businesses as well. You kind of explained that a little bit, but is that up to the business to whether people are supposed to have masks or not?
So Shanicia, I think it's a good question, and I'll follow on what the mayor said, which is, I think in some ways what the governor did is being misconstrued. So the governor, instead of mandating requirements, has put faith in the citizens and businesses of Arlington to do the right thing. So the Chamber of Commerce is advocating for us to do just that. Let's not let the governor down. Let's do the right thing. We know what works. Let's continue to do that. And I think what you'll see is a whole host of ways that businesses react. There are going to be some that will continue to require masks, and I'm sure there are going to be some that don't. So the one thing I would tell you as a consumer is, make that a part of the decision you make on where you do business. So if you're not comfortable with somebody in the way that the practices they have in place, you have the power to do something about that. We will continue to advocate for us to do the right things. We've learned a lot over the last year. There's no reason to abandon them. But I think what the governor is saying, he believes that we're at a point where a mandate isn't required anymore. He trusts Texans to do the right thing. So we'll push for Texans to do the right thing.
Now we have Roland. Roland has a question for Dr. Cynthia Simmons, the medical director. So Dr. Simmons, this question is for you. This comes from Roland. Go ahead, please.
Yes, I saw that the governor had lifted the mandate for masks, and I work with the public a lot, and I don't feel comfortable not wearing a mask. And I wanted to see what the guidelines for the city of Arlington are, and ask the mayor what he proposes also. far as wearing masks. And thanks for meeting you last week at Home Depot too, Mr. Mayor.
Great to meet you.
So this is Dr. Simmons, and I think Michael Jacobson answered that question for us. This is really a personal choice at this point. The governor has decided that mandates will not be a part of what he's moving forward with starting next week. And so again, if you're not comfortable going without a mask, then you should wear a mask, and you should also support businesses that have mask mandates. So I would encourage you to continue to do so.
Thank you. We've got a question for Dr. Simmons again. This is Etta. Go ahead, Etta.
Hello?
Hi, go ahead with your question, please, Etta.
Oh, yes. Oh, thank you. I'd just like to take one quick time. I have a question. My husband, I registered my family back in January for the vaccine, and my husband had a kidney transplant, and so that puts him in the list of the people that have compromised immune system. But he hasn't been called for the vaccine, but today I was called, and so I'm just curious as to when he will get it, because his immune system is compromised and mine is not. And I had offered to give him my shot, but I was told that I couldn't do that.
Thank you for the question, Etta. This is Dr. Simmons, and we appreciate your patience and your husband's patience in this process. To date, there have been over 370,000 vaccines delivered in Tarrant County, and there are over 650,000 people that are that are registered in the county. And so, as you can tell, there's a lot of people that are still on the list. What I would encourage you to do is to call the Tarrant County hotline and check on the status with your husband. And let me give you that number. It's 817-248-6299. And I'll repeat that, 817-248-6299. 6299. So for anyone who's interested in finding out what their status is, or if they need help registering, then you can call that hotline with Tarrant County Public Health, who is responsible for the registration system, and they should be able to give you more information about when and where your husband is on the list, and make sure that his registration is active. So thank you, and thank you for your patience as we work through this registration and vaccination process.
Up next, we have a question for Chief Crossan. This is Beverly calling in. Go ahead, Beverly.
Hello. I have a quick question. It's unclear as to what phase is actually being implemented for the rollout. I am between the ages of 30 and 65, but I've been patiently waiting for those people who are at risk, underlying conditions. It doesn't seem to be inclusive, and it seems to be inconsistent per area.
Beverly, this is Don Krause, the Fire Chief. I'll try to answer your question. Right now, we're accepting patients that are in the 1A and 1B categories. That would be, 1A would be healthcare workers and first responders. 1B would be those with the age of 65 or those with pre-existing health conditions. Today, there was an announcement from the state that we'll be adding educators to the list. So there's a gradual movement towards expanding the groups that we'll be seeing at these vaccination sites. Unfortunately, there still are a large number of individuals in these groups that have not been seen yet. So that decision is sometime in the near future. We would hope to see more people, but right now, based on the categories and the number of people in those categories, we are still limited to the 1A, 1B, and some educators at this time. Thank you for the question.
This is Irma calling in with a question for Dr. Simmons. Irma, go ahead, please. Irma, are you there?
Hello?
Go ahead with your question,
yes, is it my turn?
Yes.
Okay, my question is, with the shots, I know that there's three different shots or three different companies that are given the shots. My question is,
are we going to have to repeat getting the COVID shot every year like we do the flu shot, or how long is the shot good for?
Hi, Irma. This is Dr. Simmons, and I'll take a stab at that for you. So it's really not known, is the honest answer at this time, as to how often we get it. If we look at the history of vaccines that we have for viruses, something like the flu, it's certainly possible that we may have to get this shot yearly. But the studies are ongoing worldwide with regards to the vaccines and with regards to how long the antibodies last with those vaccines. At this time, it's very clear that the antibodies probably last at least 6 to 9 months and maybe even longer. So as we move through this pandemic and more information and more studies are available, we'll have a much better idea of how often, if at all, the vaccine may need to be repeated. So I hope that answers your question. Thank you, Irma.
Now we have Jack calling in. He's got a question for Chief Croson.
Yes, I was listening to your program. Had a chance to finally get in and talk to you guys. My number one question is about getting the vaccination, and I still am not aware of the correct way to do it. I did sign up with the Tarrant County Department of Health in December, and somebody told me to do it again. I did it in January. I got the notification via email that I'd been registered. Then, of course, that mass email came out with all the numbers, and it was incorrect. So the next thing is I've been waiting patiently, but yet still I find people who are younger than me, and I'm in my late 60s. I do have medical conditions, but I cannot seem to find a place that confirm that I am on the list. And what number am I?
Yes, sir. This is Don Krause again. I'll attempt to answer this question. This is a Tarrant County Public Health registration issue. They do have a number you can call, and they will have call takers available to try to work through your issue for you. You may have been lost in the system. It may be an issue of a transposed digit. It may be a number of things. I know that they are working through a number of issues with their registration list. Here in the city of Arlington, we take our registrations from Tarrant County Public Health. So the primary contact on this issue would be Tarrant County Public Health. And Dr. Simmons, do you have that number?
Sure, I do. It's 817-248-6299. Again, 817-248-6299.
Thank you for your question, sir.
Thank you so much. Next up, we have Susan, who's got a question for Chief Croson. Go ahead, Susan.
Yes, I had COVID back in December, early January, and have recovered. Then I went on the Tarrant County website and registered for the vaccine on January 21st. Never received any notification of an appointment. Finally got an update via text on Sunday that they were just now working appointments from those that registered on January 7th. On the news of people getting their second shots, I still haven't got my first one. I'm 65 years old. That was all put in my registration information.
Yes, ma'am. This is Don Krause. And so you're reflective of the sheer volume of people who are trying to get the shot. And certainly we're working through this list as well as we can as a county. There are a number of vaccination locations. Arlington's just one of them. And quite frankly, the throughput is an issue that they're working on constantly. I think the fact that you've had COVID, I'm going to ask Dr. Simmons to comment on your status as a person who's had COVID and how it affects potentially your timeline in regards to getting the vaccine.
This is Dr. Simmons, and so it may be, this is just a thought, that one of the recommendations from the CDC is that if you have COVID, that you wait for 90 days before you receive the vaccine. And so my thought is that potentially the reason you have not been called is that you had COVID. And so my recommendation, again, would be to call the hotline, see what the status is. of your registration, and if indeed they're waiting for that 90-day time period to pass. And thank you for being patient. There's just a lot of people that are waiting for the vaccine, and they're getting to them. We're getting to them in the county as soon as we can, as soon as the vaccine is available. So thank you.
We have a question coming in from Rosa. She has a question for Dawn Crossan. Go ahead, Rosa.
Yes. My question is, as a resident of Arlington, I expected to go to the Arlington location to get my COVID shot. Instead, I was assigned to Fort Worth for my first shot, and they required, they asked for my insurance card. For the second shot, I was assigned to the Hearst location, and again, they asked for my insurance card. My understanding is that the shot is free. And now my daughter, who lives in Grand Prairie, was assigned to Arlington. She got both her shots, never was asked for her insurance card. Could you please?
Yes, ma'am. Rosa, this is Don Krause, I'm the fire chief, and you're absolutely correct. There is no need for your insurance card. In fact, at our site, we do not ask for insurance, so your reflection of your daughter's experience is correct. I cannot comment as to why the other side asked for your insurance card, other than it's a part of a normal processing process you find in most public health facilities. I do know that we do not ask for that here, and I'll certainly pass on your question on to the Tarrant County Public Health Authority about that issue. So appreciate the question, and just want to confirm for the folks out there that here in Arlington, we're not asking for insurance information. Thank you.
Our next caller is Christine. She's got a question for Dr. Simmons. Christine, go ahead. You're live.
Hi, yes. I was wondering, according to on the vaccines, there's 3 different types of the vaccines. Are we going to be able to choose which type we want? Because I don't mind the other 2, but I do not want the Johnson & Johnson one.
So, Christine, this is Dr. Simmons, and the answer is really no. We usually only have one vaccine available at any given site at any given time. And so my recommendation to you, however, would to be that you take whatever one you're offered. The Johnson & Johnson is really effective at preventing people from becoming seriously ill with COVID and from hospitalization. And so it really is a good vaccine. And so the recommendations from the CDC, from Dr. Fauci, and from a number of scientists are that it will prevent you from being sick. It will prevent you from being critically ill. The nice thing about it is it's only one shot dose from Johnson & Johnson as opposed to the other 2, which require 2 shots. So again, I would encourage you to get whichever one you're offered first. So thank you.
And folks, we have some important information for you on testing. Residents seeking COVID-19 testing have access to nasal swab testing, cheek swab testing, and saliva testing sites at 3 Arlington locations. The first is the Park Plaza parking lot at New York Avenue. Second is Tarrant County College Southeast. And the third is the Arlington ISD Professional Development Center. These tests are intended for Tarrant County residents ages 18 and up who are exhibiting symptoms of the respiratory disease. Residents must show proof of identity to be proof of residency to be tested, and the time to receive the test results will vary based on the demand for testing. If you have questions, you can visit www.arlingtonpx.gov to learn more. We're going to keep taking questions. We also want to encourage you to press 7 on your keypad if you would like to submit your email address to the city so you can get a lot more information. Just hit 7. We have operators standing by to take down your email address. We also encourage you to press 1 on your keypad if you need help registering for a vaccine. Please press 1 and someone will call you. We're going to take our next question. This is Marion. She's got a question for Dr. Simmons. Marion, go ahead.
Hi, my name is Marion, And I wanted to find out, I'm a substitute teacher, and I'm 65, and I wanted to take the Johnson & Johnson. When and what date will they have that available?
Hi, Marion. This is Dr. Simmons. And so we received our first doses of Johnson & Johnson in the city this week, and we are looking at implementing those very soon. So we have received it, and you will be hearing more about it very soon as we implement plans for distributing that vaccine within the city. Thank you, Marion.
Thank you very much. Our next caller is Kate. I'm going to go ahead and read Kate's question. This is for Dr. Simmons. She says, I have a history of extremely bad reactions to flu vaccines, so I'm very concerned about taking one. I took the Pfizer COVID shot last Sunday because it was not made from a live virus. I wanted to let people know who may share my concerns that I had zero reactions to it. Do you have a response to that, Dr. Simmons?
Sure, Kate. That's great, Kate. I'm delighted to hear that. We have been really fortunate, and at our site, we have not had any serious allergic reactions, which is great, nor has the federal site that's just been opened and operated. And so I hope that we will continue with that. But I would encourage people who have a history of allergic reactions to any sort of vaccine to consult their physician before they come to the vaccine center. But we've really had a very good track record with these vaccines. And so I'm delighted that you did well with it, and I'm delighted that you shared that with us. Thank you for doing that.
And Dr. Simmons, we've got another question for you. This is Peggy calling in. Go ahead, Peggy.
Yes, hello. My name is Peggy, and I live in Arlington. And my daughter and I had registered for the shot back in January. And we kept not hearing anything and not hearing anything. And finally I called and did a asking my status. And they said, well, they just didn't have any information about that I was registered, but that's all they could tell me. We finally found out that they had the shots from Pfizer in Decatur at a CVS. I called them. We registered with them. We went in and had the first shot last Saturday. Had no reactions whatsoever. They were quick, easy, painless. And we go back in the end of March for our second shot. We got the Pfizer ones, and they're wonderful. But I wondered about how long it lasts. And I am going to be 80 in 14 days, and I have fifth-stage kidney disease. So I wanted to know, am I going to have to get this shot over and over again?
Sure, Peggy. Well, happy 80th birthday. That's great. This is Dr. Simmons again. And so the honest answer is we really don't know yet. As I mentioned earlier, we are not sure how long the antibody protection will last for these vaccines. The current studies show that it's probably at least 6 months, maybe as long as 9 months. So I think we'll just have to wait as we move forward through this pandemic and see what the studies show. But I don't think you'll need a shot anytime soon again, which is good news. And I hope you enjoy your 80th birthday. That's great. Thank you. Thanks for that question.
Thank you so much for your responses. Folks, another PSA, a public service announcement for you, dealing with small businesses. Small businesses are the backbone of our can-do spirit, and we encourage everyone to shop local and come together to support small businesses and restaurants across Arlington. All retail stores, restaurants, and malls are now permitted to open at 50% of their listed occupancy, and you can continue to order online for delivery and curbside pickup at your favorite Arlington restaurants, even if dine-in is closed. You can find many of these resources and useful links by visiting www.arlingtontx.gov/shoplocal. Our next question is from Yolanda. This is a caller on our Spanish line, And Yolanda's question is, I got COVID. I also got the first dose of the vaccine. Can I still get the virus? And that's for Dr. Simmons.
Hi, Yolanda. This is Dr. Simmons. And so the recommendations are for people who get either Moderna or Pfizer vaccine that they indeed follow through and get the second dose. The second dose really allows your immune system to respond to the virus and be fully protected. The first dose sort of primes your immune system, but the current recommendations, regardless of whether you've had COVID or not, is to go ahead and get the second dose. There are some ongoing studies and there are some suggestions that have come out in the science that one dose may be protective, but as of right now, the CDC and FDA have not changed their recommendations, and so it is critical that you follow through and get that second dose of Moderna or Pfizer vaccine. Thank you, Yolanda.
Here's another question for you, Dr. Simmons. This is Roger who's got a question. Go ahead, Roger. Roger, are you there? All right, so I'll just read Roger's question. He's wondering if he can wait and get the Johnson & Johnson vaccine.
Hi, Roger. This is Dr. Simmons again. So Johnson & Johnson is just coming out now, and as I mentioned, we received our first shipment. I suspect that there will be an increasing amount of Johnson & Johnson that will be distributed throughout our country through the months of March and April. Again, though, as we mentioned previously, you don't really have a choice per se when you go to a vaccine site. You can certainly find out which one they are distributing and pick, but I would encourage you, again, to receive whichever vaccine, whichever brand name of vaccine that's offered to you first and that you can get in order to protect yourself from COVID.
Great, thank you so much. Now we have Mark. He's got a question for Fire Department Chief Don Crossan. Go ahead, Mark.
Yes, hi, good evening. My name is Mark, and I was notified on Monday, 1st of March, after registering with Public Health on January 6th. I'm over 65 and I had a couple of medical conditions that qualified me to be in 1B. Now, I checking periodically, every week or so to make sure that they had not scheduled me for an appointment, and they hadn't. And I got notified on Monday afternoon, after 4 o'clock, that my enrollment or whatever is registered to be charged health resources. And then today, after 4 o'clock, coincidentally, I got a notification from THR that I could schedule an appointment. But all the locations for THR are not in Arlington. Their closest one is up in Bedford, ATB area. They're on 121 Airport Freeway, on the 16th Hospital Parkway. The other ones are in Fort Worth or Corinth, Texas, far north of the Metroplex area. So this was very, very upsetting to be rescheduled to go wait to get to THR. But THR did come through within a couple of days, but they have the locations not anywhere nearby in Arlington. I was really looking forward to going to the eSports Stadium or one of the Globe Life Field areas or wherever else they're doing it, AT&T Stadium or whatever, since that's only less than 2 miles from my house. In Arlington, west of downtown, about 1.5 miles or so, and near Fielder and Abrams Street intersection. So this is, to me, a problem that the County Public Health Department would hand off some people like me that's registered fairly early on in the program. He handed off to THR here, like kind of over a couple months later almost.
Okay. So Mark, this is Don Krause, and I'm the fire chief, and I certainly share your concern, understand your situation, but the reality for all of us is that we're in an emergency situation. What we're running in Arlington is an emergency mass vaccination clinic. We're part of a system of clinics that have come together from nothing essentially to vaccinate the public in the best way that we can, with one central intake point at Tarrant County Public Health, who is who's distributing registrants as best they can based on the information they have and the participating vaccinators. And so the reality is it's not the perfect sort of point-of-service provider of vaccinations that you would hope for, that you experience with your doctor when you schedule an appointment. The reality is we're all in an emergency. We're all trying to get these vaccinations out as quickly as possible. So people are being distributed as the computer system distributes them at Tarrant County Public Health. And granted, it's not a perfect system. It's the system that is distributing people to locations where vaccines are available. Now, as far as the individual sites that are providing vaccines, the only one I can really speak to is the one that we run here at Arlington, in Arlington at the Esports Center or Globe Life Field. I'll certainly pass on this information to the Director of Tarrant County Public Health about your concern. But again, I'm asking the public to please consider the fact that this is an emergency mass vaccination effort never seen before in our community or in our country. And quite frankly, the systems that are being set up are doing the best they can, but they're not perfect in their design or their distribution. Thank you for the question.
Thanks very much, Chief Croson. We've got a question for Mayor Williams. This is Mark calling in. Mark, go ahead with your question.
Hi there. First of all, thank you guys very much for doing this. It's absolutely excellent. The clarity and the transparency is what I'm trying to say. It's fantastic. Please do more of these. Getting this information out is great. Part two, my wife was actually asked for her insurance card as well. I was not. Just one of those things I think that's going on in Tarrant County at different kinds of situations. My question is this. I had two. Ranger Stadium, Cowboy Stadium, the governor said we're open to 100%. I just can't imagine that the city of Arlington is going to allow 50,000 people in one and 90,000 in another. And so I was curious about that, and also about, let's, God forbid, there is another spike. What is Arlington's threshold? Are we like 50% or 15% going back into the hospital again, doctor, or how is that going to be calculated?
Mark, this is Mayor Williams. I'll take the first part of the question, and I'll turn the second part over to Chief Crowson and Dr. Simmons. But the first part, I've actually talked to our partners there at the stadiums, and they are evaluating. They did not know this was coming, and so they are evaluating right now, and I think they will be very responsible and cooperative, because they are very interested in keeping their customers, the fans, safe, and their employees there. So they were very much leaning towards keeping the mask mandate and the social distancing there on it. And needless to say, every organization right now is scrambling to see how to respond to this. And then Chief Crowson and Dr. Simmons, there have been working with all of our corporate partners and so forth there. But I've got to say now that the Cowboys organization and Ranger organization very early on volunteered there to be a vaccination center or to use their facilities here during the pandemic, and very much appreciative to them. And now the Globe Life Field is a major FEMA vaccination center there, and very much appreciate Chief Crowson and Dr. Simmons for their help there in sharing with our military what we've been doing in Arlington, and it warms my heart to see our Arlington Fire Department working alongside the military, vaccinating our citizens. It's very uplifting. Then as far as what spike will do and what may send us back here to mandates, I'll turn it over to Chief Crowson.
So Mark, to the mayor's point, in fact, I had two conversations today with both representatives of the Dallas Cowboys and the Texas Rangers about this very issue, and know that this is an evolving issue, and that their concerns are very much as the mayor articulated. So we're working through those issues in a thoughtful manner to make sure that we're going to make sure things are safe and effective for fans and for the operators of these venues. Now, from a monitoring perspective, we watch all the metrics very closely. In fact, we report to council on a regular basis what the metrics are. And if they're moving in the right direction, we tell the council that they're moving in the right direction. If they're moving in the wrong direction, we'll tell them that they're moving in the wrong direction. Now, as a team, we have a very focused concern about the COVID-19 and how it's moving in Arlington. And so if things start to move in a direction that's concerning, we'll be ringing the bells and working with our leadership teams and our community partners on the issue. So I don't feel like we're going to walk away from this or just sit down and let the thing move as it is. We're staying on top of the issue all the way back till we are normal. Know that if you watch our council meetings, you see that we report on this issue with great regularity, and we are very invested in protecting our community, and so, quite frankly, so are many of our business partners. So know that we are collectively focused on the issue, and there's no effort to say this thing is over, because we're not going to do that, because that's just not who we are as a city public safety team. Thank you for the question.
Thank you, everyone, for your great questions tonight. If you would like to submit your email address, we do have operators standing by. Just hit 7. They'll put you on the list to get updates from the city of Arlington on COVID and other important items. So please press 7 now. Also, just want to remind you that if you need help registering for a vaccine, then please press 1 to let us know, and someone will call you. So press 7 to share your email address. Press 1 if you need help registering for a vaccine. And for all of those of you who do have questions, we're going to do our best to get through as many as we can. And if we aren't able to get to your question, then we'll be able to reach back out to you with some responses. I do want to give you a little bit of information from the city on the winter storm recovery. The city of Arlington continues working to provide relief to residents and businesses and connect them with the available resources as they recover from the recent extreme weather event. Many of these resources, including water and food assistance, housing assistance, and FEMA disaster assistance, can be found at the city's storm recovery webpage at www.arlingtontx.gov/storm-recovery. Our next question comes from Dionysia, and she's got this question for Dr. Simmons. Go ahead with your question, please. Dionysia, are you there? I'll go ahead and just read her question, and that is, how is it determined which shot you get?
Hi, Dionysia. This is Dr. Simmons. And so the answer is it really is just determined based on which site you're assigned to. If you're eligible to receive the vaccine, then as your name and your number come up, you're assigned to a specific site. And depending upon which site you're assigned to, depends on which vaccine you'll get. Some are giving Pfizer, some are giving Moderna, and soon Johnson & Johnson will be coming out. And so other than that, there's no determination. It's just a matter of when you're up, which center you go to, and which vaccine you get. So I hope that you're able to get vaccinated soon. Thank you, Dionysia.
Another question for you, Dr. Simmons. This is Courtney. Courtney, go ahead. You're live.
Hello?
Hi, Courtney. Go ahead with your question, please.
Hi, yes. I wanted to ask if anybody has any idea on how Governor Abbott's, surprise trust that he all of a sudden came up with in Texas residents to wear a mask and open everything 100% up. Is that going to affect the schools and their mask mandates? And has anything been talked about as far as virtual learning being affected?
Hi, Courtney. This is Dr. Simmons. And so for schools, we've had ongoing conversations here locally as well as statewide. The TEA today came out with recommendations, and as you know, this is an ongoing conversation. But the TEA today came out with recommendations and offered superintendents guidance on the ability to continue to wear masks. And they've been very clear that if the superintendents decide or the school boards decide that they want to continue with masks and social distancing, they may choose to do so. But the governor's lifting of his mask mandate really allows local control for those districts and those superintendents to decide what they think is important in their communities based on the disease and based on what they're experiencing. There are no mandates from public health at this point, and there are no mandates from Tarrant County. But as these conversations go on, as TEA and as the local districts have the opportunity to react to this movement, they will move forward and make the decisions. We are still, from my position as public health authority, we are recommending to the districts social distancing and masking, but again, it's a recommendation, and the districts will act autonomously and independently as they move forward to make the best decisions that they can for their students and their staff. So thank you for that. It's a really good question. Thank you.
We've now got a question for Michael Jacobson, the President and CEO of the Arlington Chamber of Commerce. This is Beth. Go ahead with your question, Beth. Hi, Beth. Are you there?
Oh.
Go ahead with your question, please, Beth.
Yes, I'm here. I have a question about those. Yes, my question is, I'm speaking for many who don't believe the vaccine is the right option. That we believe that the vaccine is kind of a money making for many pharmaceutical companies and other options. When I myself had the China flu, and I was given good medical care and medication that it did have to take its course, but it handled it. And I'm also been taking supplements to bolster my immune system. I think there is other information out there that our CDC and our infamous Dr. Fauci have overlooked, and they've skewed numbers, and they've revised them constantly because this is so it's so open to interpretation for a lot of people, a lot of things. So I just think I am 65, and I know there are others who feel the same way as I do, that I don't want to be ostracized because I won't wear a mask or I won't get a vaccine. And that's about all I'm hearing in this presentation right now is how to get a vaccine, why you get a vaccine. Maybe you'll survive this.
So, Beth, this is Michael Jacobson. I'm not sure I'm the best person to respond to this question, but I will respond, and then we'll let others. So, COVID-19, I think right now we're at about 50,000 deaths. Is that about right? 500,000, excuse me. 500, I got the wrong zero. 500,000 deaths. I think there's no question that COVID-19 is a significant health risk like one we have never seen, and that we as a community have to step up and do the right thing to not only protect ourselves but protect others around us. So I would hope that we all take those sort of precautions, not because the state requires us to do it or because the federal government requires us to do it, but we care about our fellow citizens, and because we care about them, we're going to try to take care of them. When it comes to business and what business can do, the governor's announcement was fairly clear, which was, there's not a mask mandate. Certainly businesses, if they choose to, can completely do away with the mask mandate. There are 22 hospital districts in the state. If any of those 22 hospital districts, if there's 7 days 15% of the people in the hospital have COVID-19, then at that point, the county judge can take action. But even then, the county judge cannot reduce occupancy for any business below 50%, and the county judge cannot shut down a business, and the county judge cannot criminalize not wearing a mask. Now, what people do will be up to people, but certainly there are those sometimes who feel they're ostracized when they wear a mask. And there are those who feel like they're ostracized when they don't wear a mask. So what I would tell and hope that people will do is they'll be compassionate about the people around them. They'll understand what's helped us as a society over the last year. They'll continue to practice that, and they'll be courteous to others. And at this point, based on what the governor has put in place, that's where we are. And the thing I would say is you may look to the city and others and say, but what are you, the city, going to do? Or Dallas County's doing this and Tarrant County is doing that. The reality is there are limitations that have been set. So we're just going to have to look and care about each other. And as I say, the governor's put faith in us as citizens. So let's not let them down. Let's do the right thing.
All right. Up next, we have a question for Dr. Simmons. This is Teresa. Go ahead, Teresa.
Yes. I am almost 57 in a few days, and I have underlying conditions. I had cancer, and my immunity is still low. I had the lump removed. So I signed up, and I have friends and coworkers who are younger than I am, and they've already taken the vaccine. Why is it taking so long for me to be called for a vaccine? And I don't care what kind. I just want to have the vaccine.
Sure. Hi, Teresa. This is Dr. Simmons. And so it is a daunting task that the county is facing. And right now, the biggest limitation on getting the vaccine is just the supply. As I mentioned earlier, we have about 650,000 people registered in Tarrant County to receive vaccines. And as of today, 230 of those, 1,000 of those people have received at least one vaccine. About 137,000 have received both sets of vaccines, either Moderna or Pfizer. So while we're making progress, it's slow progress. We are working, as Chief Crowson said, in an emergency situation, and we have 2 major vaccination centers that are ongoing in the city of Arlington. And so we're working expeditiously and as quickly as we get vaccine to get it into arms. I would encourage you, again, to check the website or call the hotline. Again, 817-248-6299 to check on the status, to make sure that you're appropriately registered, that they have your information, and that and hopefully you'll be getting an appointment very soon. Thank you for being patient with us as we work through to get everybody vaccinated. We sure do appreciate it. And hopefully you'll be coming up soon.
Now we have a question for Mayor Williams. This comes from Arlette. Go ahead with your question, please, Arlette.
My phone froze.
Hi, Arlette. Are you there?
Yes, I'm here.
All right, go ahead with your question. We hear you.
You can hear me?
Go ahead. Yes, we hear you.
Oh, good. Okay, my phone froze. I'm sorry. Well, I kind of was curious. Okay, so I think one of my questions, like I said, have already been answered throughout the course of the meeting. Because my biggest concern was what criteria did we really use to just open up Texas, because it seems a little weird considering that, I mean, it's still not under control the way I feel. Like, we should be before we just open it up. But anyway,
Well, Arlette, this is Mayor Williams. We don't know what all was behind the governor's decision, but let me be sure and clarify that actually the governor is just giving us a choice there, and we definitely are recommending that we continue on following the CDC guidelines because we do have so many of our citizens that still need to be vaccinated, and many who have not had COVID, so they haven't had time to build up the antibodies. And so consequently, you're seeing a widespread response, and definitely here in Arlington, both from our city and our Chamber of Commerce, that we are they're urging our citizens and our businesses to continue to comply with the CDC guidelines and choose to do that. And we certainly hope that our citizens will be responsible because it really will help slow this spread. And then you've heard from Chief Krausen here earlier. We are all receiving information that we are hopeful in the next couple of months that we will have vaccines in a very plentiful supply. So we're hopeful.
Thank you very much, Mayor. Another question here for Dr. Simmons. This comes from Eva. Eva, go ahead, please.
Hello?
Hi, Eva, go ahead with your question, please.
Hi. I was wondering, my husband and I are very concerned because they've lifted the mandate on masks and things. And we have continually tried to support restaurants and all, but are very fearful now because we don't know if you're going to be wearing a mask and you're trying to go out to eat or whatever the case might be. My husband has ESRD, and we had COVID at the end of January, and he was very critical. Thank God didn't end up in the hospital, but it was very dicey there. And so, we're wondering about going out. It's almost like we can't go out at all anymore, can't do anything anymore because nobody wants to wear a mask. And so another question I have is, we had COVID. How long do we have to wait, or do we have to wait to get a vaccine?
Hi, Eva. This is Dr. Simmons. So the recommendations from the CDC are that you wait for 90 days after having had COVID. So I would think about April would be a time frame when you would want to get the vaccine. And yes, you should get the vaccine. The immune response from the vaccine is much stronger actually than having COVID from the disease. And so I would recommend, especially with your husband's medical condition, that you receive the series of vaccines to fully protect both of you from this terrible disease. So I hope that you're able to do that, and I'm glad that you both have recovered.
Thank you. And unfortunately, folks, we are approaching our allotted time for the evening. We will try and get back to you with the questions that you've asked, but before we end the call, we'd like to turn the remainder of the call over to your Mayor, Jeff Williams, to bring us to the finish line. Mayor Williams, take it away, please.
Well, very much appreciate the calls that we've had there and some great questions. And I've got to say thank you to the Arlington Fire Department and our city's health authority. Chief Krause and Dr. Simmons have done incredible work, and very much appreciate their staff because they have been working overtime to help get our vaccinations done. And then there is hope there. We have great hope of our vaccine supply really increasing, and we know that that is a major step in getting the pandemic behind us and to be moving into economic recovery and a better health for all of our citizens. And then the other thing I'll share with you is that the mandate for mask has been removed, but however, that was strictly giving our citizens a choice. And you've heard tonight from the president of the Greater Arlington Chamber, Michael Jacobson. They're urging the businesses to continue on following the CDC guidelines and wearing the mask. And that is so important. And then here, our city is also encouraging our citizens to do the right thing and continue wearing the mask and following the CDC guidelines. So let us continue to work together, be considerate of others, and we want to defeat this virus. And we know that vaccinations, wearing the mask, and social distancing and watching our hygiene are so important here, and those are tools that we know that work. So let us continue to work together here in our city, and we look forward to these better days that are coming. And we'll continue on communicating. I'd love to direct you to our website. It's arlingtontx.gov. It's a wealth of information. And then we also want to direct you to our Tarrant County Public Health Authority for you to be able to register if you've not to be vaccinated. And then if you have registered, stay tuned. There we are hopeful they will be contacting you. And if you hadn't heard from them in a while, we heard before from Chief Krause and Dr. Simmons, you can call that number. And there, Dr. Simmons, you happen to still have that number?
Sure I do. It's 817-248-6299.
Well, thank you very much, Dr. Simmons, and we wish everyone a very good night and a happy rest of the week. Thank you very much.